ADHD, Attention Deficit Hyperactivity Disorder by Jasmine Trotter. ADHD Statistics, Features, and History. ADHD is caused by an impairment in the central executive system used to control the working memory. Dysexecutive syndrome is the effect of the impairment. This varies from patient to patient with different side effects. It also includes behaviors such as planning, memory, processing info, attention, and how we control our impulses. ADHD Statistics, Features, and History. People with ADHD suffer from cognition issues. Unilateral space neglect limits the function of the left side of the hemisphere, causing spatial neglect. Information competes to gain full access to a limited amount of space. It affects almost 6 million children between the ages of 3 and 17. Children are usually diagnosed roughly around the age of 7. Boys have been known to be diagnosed more often than girls. It is difficult for people with ADHD to switch between tasks. They have a hard time controlling their expressions. Also, difficulty remembering and storing information. DSM-5 criteria, including additional conditions. 1 must be diagnosed by a healthcare professional. Evaluations must determine the state of the person with the DSM-5 classifications, also having prolonged experience over a 6-month period in certain settings. For more information, you can also click on the link. Physiology of ADHD. There are advantages to being diagnosed with ADHD, being able to multitask and accomplish many things, also having the courage to try new things. Treatment options. The first one is stimulants. Stimulants produce dopamine and also neurotransmitters. Stimulants also help focus and execute tasks that is sent via the neurotransmitters. Over half of the symptoms are lowered using stimulants. It does have cautionary suggestions while you are taking such stimulant. Results are greater with behavior implications in place to go along with the stimulants. So not only is it good to take the stimulants, but also have a routine in order that is also in place to go along with the stimulant for better results. Another option would be behavior therapy. Behavior therapy illustrates the behavior that is acceptable in society. It also encourages rewards for displaying positive behaviors. And also when negative behaviors are displayed, punishment is also executed in hopes that this will redirect behavior. This provides a more structured environment. Neurofeedback is another option for treatment. Neurofeedback uses waves to improve the function of the brain that is damaged. Brain function is able to be retrained and rewired effectively, creating better judgment and behavior. This treatment alters the abnormal brainwave pattern by using auditory and visual feedback to the brain. Usually this corrects itself. Considerations for parents and educators. Being attentive and knowledgeable about ADHD, knowing that ADHD is not a disorder, it's just an attention deficit. Also making sure that there's engagement kept in tasks and exercises also help maintain, and not only that, proper communication. Also, additional considerations is showing empathy towards people that have ADHD, recognizing the behavior and implementing a plan of action once diagnosed, seeking necessary treatment and not viewing it as a crutch, but a difference in cognition.